Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73100, radiologic examination, wrist, 2 views. 73110, radiologic examination, wrist, complete, minimum of 3 views. These views are used to evaluate the wrist joint and adjacent structures, including the distal radius, ulna, and carpal bones. The number and type of views directly affect CPT code selection. Grouped by clinical focus, standard views, PA view, lateral view, oblique view, orthopedic or post-op views, clenched fist view, radial deviation view, scaphoid PA ulnar deviation view, scaphoid PA axial view, axial carpal tunnel view, carpal bridge view, report example, order exam, wrist 2 views, right, header, PA and lateral views of the right wrist. History, post-op, comparison, right wrist radiograph 124-2023. Findings, osseous demineralization, volar plate and screw fixation of comminuted intra-articular distal radius fracture with improved alignment. No evidence of hardware complication. Unchanged non-displaced ulnar styloid fracture. Normal radiocarpal and distal radio-ulnar joint alignment. Unchanged first CMC osteoarthritis. Diffuse soft tissue swelling, impression post-surgical changes from right distal radius fracture ORIF with improved alignment. Unchanged non-displaced right ulnar styloid fracture. Let's look at the views. PA view, lateral view, that's a total of 2 views. This qualifies for CPT code 73100, radiologic examination wrist, 2 views. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, the exam was performed as a routine post-operative evaluation of the hardware placed for a distal radius fracture. The ulnar styloid fracture is an unchanged finding. The imaging shows no new acute injury, and this is a subsequent encounter. The most appropriate ICD-10-CM codes are S52.591D, other specified fracture of lower end of right radius, subsequent encounter for fracture with routine healing. This is the primary reason for the imaging evaluation of hardware and healing. S52.611D, non-displaced fracture of the styloid process of right ulna, subsequent encounter for fracture with routine healing, and Z98.1, arthrodesis status. The presence of surgical fusion or internal fixation is documented in the report. Correct codes for this report include CPT 73100, right, radiologic examination wrist, 2 views, and ICD-10 S52.591D, S52.611D, and Z98.1. Report example, order exam, wrist 3 views, right. Header, PA, lateral, and oblique views of the right wrist. History, post-op right wrist 4-corner fusion with scaphoid excision. Comparison radiographs from 8/29/2022 through 10/27/2022. Findings, diffuse bone demineralization, post-surgical changes in scaphoidectomy with 4-corner fusion. 2 interlocking screws traverse the lunocapitate and lunohamate intervals without periprosthetic lucencies or fracture. Moderate narrowing of the radiocarpal space, chronic non-union of the ulnar styloid process. No acute fracture or dislocation. Soft tissues are unremarkable. Impression, unchanged scaphoidectomy and 4-corner fusion. Hardware is intact. Let's look at the views. PA view, lateral view, oblique view. That's a total of 3 views. This qualifies for CPT code 73110, radiologic examination wrist, complete, minimum of 3 views. The report findings state that the imaging is a follow-up after a documented 4-corner fusion and scaphoidectomy. The report confirms hardware stability and chronic, unchanged bone findings, including demineralization and non-union. The most appropriate ICD-10-CM codes are S52.611K, displaced fracture of right ulna styloid process, subsequent encounter for closed fracture with non-union, chronic, stable fracture of the styloid process. M. 25.831, other specified joint disorders, right wrist, bone demineralization without a more specific underlying diagnosis. And Z98.1, arthrodesis status, represents post-surgical fusion status after 4-corner fusion. The correct codes for this report. CPT code 73110, right radiologic examination, wrist, complete, minimum of 3 views. ICD-10-CM codes are S52.611K, displaced fracture of right ulna styloid process, subsequent encounter for closed fracture with non-union, M25.831, other specified joint disorders, right wrist, and Z98.1, arthrodesis status. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.